40 years since the first cases of what later became known as AIDS were officially reported, an estimated 40 million people worldwide have died of AIDS, with an estimated 37 million currently living with HIV and 1.5 million newly HIV infected people in 2020. To commemorate World AIDS Day, Delta Sigma Theta Sorority Incorporated, Contra Costa Alumnae Chapter, would like to thank you for joining us as we interview Makia Smith. Makia is a graduate of the University of the Pacific, where she obtained a Bachelor of Arts in Sociology, and Columbia University, where she obtained a Master of Science in Social Work. Makia has over 8 years of experience and currently works as an educator, advocate, and social worker with HIV and AIDS clients at New York Presbyterian Weill Cornell Medical Center. Makia is a proud member of Delta Sigma Theta Sorority Incorporated, initiated in the spring of 2011 through the Lambda Tau chapter. Makia, thank you so much for joining us today.
Thank you so much for having me. It's an honor to be here to talk about this important topic.
So let's get started. Let's talk a little bit about HIV and AIDS and how it is impacting our communities. I know that many people use HIV and AIDS interchangeably. Can you define and explain the difference between HIV and AIDS?
Absolutely. That's a great first question because it does get used interchangeably and they are not the same thing. So HIV is human immunodeficiency virus, whereas AIDS is acquired immune deficiency syndrome. So HIV is a virus, AIDS is a disease. So HIV, you get AIDS from uncontrolled HIV. So if you have HIV that's not treated, it can lead to getting AIDS. But you can both have HIV and AIDS diagnosis. If you have an AIDS diagnosis, you'll always have an AIDS diagnosis, but you can live a very long life with both an HIV and AIDS diagnosis as long as you're taking your medications and you're seeing your doctor 2 to 3 times a year. So.
Thank you. So there are many misconceptions about how HIV is contracted. Can you share some of those misconceptions and tell us exactly how HIV is contracted?
Absolutely. There's a lot of myths and fables that are out there of how people can get HIV, and I'm here to tell the truth. So HIV is not, I repeat, not spread through saliva, spit. You cannot get HIV from kissing, sharing food, drinks, using the same fork. It's not spread through hugging or holding hands, sneezing or coughing, and not from a toilet seat. These are real things that people really think how you can get HIV. But how you can get HIV is from vaginal sex, anal sex, sharing needles, getting stuck with a needle from an HIV infected blood on it. You get from infected blood, semen, vaginal fluids into open cuts or sores on your body. It can also be passed through to babies during pregnancy, birth, or breastfeeding.
Who is at greater risk for contracting HIV, and what are some of the risk factors?
So according to the CDC, the people who are impacted most by HIV are gay and bisexual men who have sex with other men. But if we break it down to race and ethnicity, it's definitely Black and Hispanic people who are disproportionately affected by HIV, and also transgender women who have sex with men. And also injection drug users are at high risk of getting HIV.
Okay. So I heard you say something about the CDC. So let's talk a little bit about the CDC. I read a statistic where, per the CDC, Black and African American people account for a higher proportion of new HIV diagnoses and people living with HIV compared to other races and ethnicities. What do you believe has attributed to these numbers?
Definitely social and economic factors like poverty, racial discrimination, lack of access to healthcare, and people thinking that this is a white gay disease. So the misinformation or not being informed that this is a disease and virus that impacts Black communities at a high rate, and also distrust in the healthcare system. You know, with our history in the Black community, there has been many reports shown that what happens when we trust the healthcare system, and we've been taken advantage of. And so a lot of people are very hesitant to go to healthcare systems and seek care or even get tested. And so a lot of people do not know about their HIV status or are even willing to go find out about their HIV status because they don't trust the healthcare system.
So let's drill a little bit more down into, we understand that African Americans, Black people, and Latinos or people of color are at a higher rate of contracting HIV, but let's talk about Black women in general. And I understand that we are disproportionately affected by HIV. Can you talk about the alarming rates and what are some of those factors that are contributing to those rates?
Yeah, so the alarming rates definitely contribute to what I said before about, lack of access to care, poverty, and within the Black community, we have higher rates of sexually transmitted diseases. But the main thing that impacts Black women is the lack of sexual networks. So what happens is, especially within the Black community, we have our Black men who are incarcerated or who identify as gay or bisexual and having sex with other men, getting contracted with HIV, and then having unprotected sex with women. And so it just becomes this revolving door of people within our community becoming infected with HIV. So unfortunately, Black women have the highest rate of getting HIV more than any other ethnicity. So it is about being cognizant of these numbers and getting tested if you're sexually active at all, because we are the ones who are being impacted by this at a greater rate. So Black women, we need to know our status.
Great, thank you for that. And so I'm an 80s baby, and I know that in the 80s and 90s, there was such a push of activism and advocacy through media campaigns that brought attention and awareness to HIV and AIDS. And we know that it was discussed in our schools. We saw the billboards, we saw the MTV ads, and there were so many stories about HIV and AIDS and faces of HIV and AIDS. And so I'd really like to understand why we don't hear about HIV and AIDS, why we don't see the posters, the social media campaigns about it. We are the TikTok generation and the Instagram generation, and these kids are not talking about HIV and AIDS. It's not being talked about in their schools. So, I mean, I have my thoughts on it, but can you tell me what are your thoughts on the lack of education around HIV and AIDS, especially in our community?
Definitely. So I'm gonna be very honest about this, everybody who's watching this. When you think about when the epidemic first started, people saw it as a gay man's disease. And once we started seeing it pouring into the white communities, that's when there was more attention attached to HIV and AIDS, what's in the epidemic, all of those things. And I think once that big push happened and we saw a lot more, campaigns and people talking about, know your status and all these things, once it, went into the white communities, it was something that was important and talked about. And I think now with the development of medications and, not white people not being impacted by HIV at a higher rate, it's not talked about as much, but it needs to be because it's still a very big problem in our communities. So I think that's where it comes from. And what happens, in Black and marginalized communities and impoverished communities, these type of situations aren't talked about. There's what I talked about before, where access to care, access to education, it doesn't come to our communities. We're not aware of it, and ignorance kills us. And that's what's happening. And so since we're not aware of it, it's not talked about. And, kids don't know about HIV. People think that HIV is gone, and it's not. It's very rampant. People are still being diagnosed with HIV, and especially in our communities. And it's something that we cannot stop talking about.
Thank you for your candor. So, in terms of your clientele, without asking about any names, but if you could just share with us, what's the youngest person that you've worked with that has contracted HIV, as well as can you tell us some of the issues that they face?
Yes, definitely. Well, I work in an adult clinic, so the youngest I work with is 18. So what happens where I work, there is a pediatric clinic downstairs, and so right when they turned 18, they came up to me. And so a lot of my patients, they were born with HIV, where we call that perinatally infected. And so a lot of the issues that they face is pill fatigue. They've been taking these big pills, and at the time when, there wasn't this development in medications, they're taking 6, 7, 8, 10 pills for their whole lives, and they're sick of it, and they're tired, and they're resentful that they are attached to this this virus, where they're attached to this virus where they didn't have anything to do with getting HIV. They didn't, inject any drugs. They didn't have any unprotected sex. They didn't do any of these things. So, you know, you have all those feelings of not feeling like you can have a quote unquote normal life. You know, think about a 13 or 14-year-old who wants to date, or 15, 16, 17 who wants to start having sex and having this HIV diagnosis and trying to have this conversation with people your own age. That's not something that happens too often. So it is very difficult for them to navigate life because they are very resentful and tired of this quote unquote secret that a lot of them have. So it is definitely my hardest population to work with, and seeing people in their 20s, their early 20s, who stop taking their medications and their viral load goes up, when viral load means that that's how much HIV is in your body, and their CD4 count, which is what we see if you have an HIV diagnosis or an AIDS diagnosis. If it goes below 300, that's an AIDS diagnosis. And these young kids end up developing AIDS and die. And it's something that's preventable. And it's very sad to see because, you know, living with HIV your whole life, it ends up killing a lot of our young kids. So.
And then in terms of, I know that you stated some of your clients came for the pediatrics. Can you talk about clients, the age range that newly contracted, not born with, but newly contracted? What's that
Newly
age range look like?
Yeah, newly contracted, definitely my youngest is probably like 25. And even within the young population, a lot of these are young kids of color, or young adults of color, who are more sexually active, having unprotected sex, and they're also in the LGBT community. So where they're having a lot of risky behaviors of unprotected sex, going to sex parties, having partners who they don't know have HIV that, you know, people aren't disclosing or people aren't aware. And so a lot of these young kids of color, or young adults, let me not call them kids because they pay taxes, you know, they end up having HIV. And, you know, for them, they think like, you know what, I should have known better. And they have the education, they're aware of it, but they're just like, I heard of HIV, but I just didn't think it would happen to me. And so that's what a lot of people think, is that, you know, I've heard of HIV, but I didn't think it was going to happen to me. And now you're 25, HIV diagnosed, and now having to manage a life of, you know, taking medications every day. And like I said, this is preventable. And the good thing is this isn't a, you know, a virus that will kill you. It's not a death sentence like it was back in the 80s and early 90s. It's, you know, it's treatable, but it shouldn't have to be something that's treatable if you know the things that you have to do to prevent getting HIV.
Let's talk about that. What are some of the biggest misconceptions about living with HIV/AIDS?
The biggest misconception is literally, I'm going to die. I have patients who range from different ages who, you know, still don't even know about, you know, what HIV is. I had a man who was in his 40s and, you know, diagnosed with HIV, and I went to go see him in the hospital, and he's just like, you're not afraid to be next to me? You're not afraid that I'm going to give it to you? And I'm just like, no, that's not how it works. And, you know, even explaining to him, you know, a man in his 40s, you know, what HIV is, and that it's not something that's going to kill you. As long as you take your medications, you'll be fine. So a lot of people still think it's a death sentence. A lot of people think there's a face of what HIV looks like. I have patients who are doctors, lawyers, med students, social work students, houseless, homeless, using drugs. It's a range. There is no face to HIV. Anybody walking next to you can have HIV. It's just about what you as a person, once you're diagnosed, what are you going to do with that diagnosis?
Good. So is it possible for a woman to be pregnant and not transmit HIV to their newborn child?
Absolutely. And it's one of the best things that I experienced is that we have our own OBGYN at our clinic. And so she, you know, works with women to get pregnant. And as long as they're taking their medications every single day and maintain an undetectable viral load, and undetectable means that you're taking your medications every day, that you can't even tell that there's HIV in your body. If we do a blood test, it shows undetectable, like where is HIV? We don't see it. You still have HIV, but you're so well controlled that you don't see it in your body. So if a woman who's pregnant maintains undetectable, or at least as close to undetectable as possible, they can have a healthy baby without HIV. When the baby's born, they'll take AZT, for 4 to 6 weeks, that they'll give the baby to ensure that, the HIV really doesn't get into their body. But as long as the mom is taking care of themselves, no problem at all.
I heard you talk about testing. Can you talk to us about what testing options are available?
Yeah. So usually when people see testing, like if you're like going to sometimes I go to coffee shops and I'll see like, oh, we're doing HIV testing. A lot of those are rapid testing. So they're just swabbing the inside of your mouth, and you can get an HIV test by getting your antibodies. So just seeing antibodies means you can see based on antibodies if you're reactive or non-reactive to an HIV test. So within that, you'll get that result within 20 minutes right in front of you. But then there's also the blood test that's more efficient and will let you know if you have HIV or not. I recommend that people get tested for HIV depending on how sexually active you are. If you are sexually active at all, I don't care if you're married, in a relationship, anything, you should get tested every 3 to 6 months because you just never know. You want to know your status at all times. A lot of places, if you're going to a doctor's appointment, they don't ask you if you want to get HIV tested. So you be proactive and say, can I get an HIV test? Every time you do an annual, when you see your doctor, hey doc, can I get an HIV test? Just ask them. And so it's important to know your status. So like I said, if you're sexually active, you should be tested every 3 to 6 months.
Well, let's talk about that. So are there any stereotypes that you know or stigmas that prevent people from being tested?
Absolutely. Just mainly just thinking that, like I said before, HIV is a gay disease. So, you may have heterosexual men and women who are just like, oh, like I'm in a straight relationship. I don't need to get tested for HIV. That's for, those young gay kids who are just running around having sex. And that is definitely a misconception. If you are a sexual being, if you are having sex, you can get HIV. And so therefore you should get tested. And that's the big misconception. People think that they're immune to getting HIV because they don't quote unquote fit the demographics that people have put the face of what HIV is and who should be getting tested for HIV. It's not just for gay people, it's for everybody. Anybody can get HIV.
Great, thank you. So let's talk about treatment. And for your clients and those that may have received a diagnosis, right? We know that it's not a death sentence. So let's talk about some of the advancement in medicine treatment, medical treatment that you see for prevention as well as suppression.
Absolutely. So in terms of suppression, making sure that if you do have HIV, that your viral load is as low as possible and your CD4 is as high as possible. That is when you're taking your medications that your doctor provides. The main thing is that, back in the 80s and 90s when, we were trying to figure out what's going to help, back when they did find medications, people were on like a cocktail of like 10 meds, and it was a lot. Now we're down to one pill. You can take your pill in the morning, afternoon, or at night. As long as you take it at the same time every single day, you're good. Take your meds, go on with your life, you're fine. Make sure that you're going to see your doctor at the recommended time. If it's every 3 months, every 6 months, go to see your doctor. So that's a good thing about suppression. When it comes to prevention, for the past 4 to 5 years, we've really been pushing PEP and PrEP, and I'll explain both. First is PrEP. So PrEP is pre-exposure prophylaxis. So what PrEP is you're actually taking HIV medication to prevent getting HIV. So if you're someone who is dating someone who has HIV, or you're sexually active and you just want to be proactive, and you know what, I'm out here in these streets having sex, I just want to make sure I take this pill so I prevent from getting HIV. A caveat that you still need to get tested for, other sexually transmitted diseases. This doesn't, stop you from getting other STDs. It's just, a prevention for HIV. But PrEP is a good way of prevention because you're taking HIV medication while you're having sex, and it's a good chance that you will not get HIV if you're taking PrEP. For PEP, which is post-exposure prophylaxis, this is if you had a known HIV exposure. Say you had sex with someone, was not aware that they had HIV and it was unprotected, or the condom broke, or something happened. Within 72 hours, you'll start taking HIV medication to make sure that the HIV doesn't get in your body, and you'll take it for a month. So you can do this by going to the emergency room, you can go to your doctor, but it's important that you do it within the first 72 hours you can take PEP. So just thinking about the advancement of where we were years ago and where we are now, it's really incredible.
So are there any challenges you see with Black people receiving access to treatment?
Absolutely. And I wish it wasn't a hard absolutely that I'm giving you, but I
Mhm.
mean, as we see, when it comes to Black communities, we're pretty much always left out. And it's sad because, there may be care, but care is not close by. You may have to travel for good care. You may not have access to get insurance. Yes, there may be Medi-Cal, but for those people who make a little bit too much for that, and then you're in this, this middle of just not having access to insurance, these medications cost over $1,000. So think about if a Black person does not have insurance because they make too much for Medi-Cal to get assistance from the government, but they don't make enough to pay for their own insurance. They're not able to get those medications that cost over $1,000. And unfortunately, they'll end up dying because there's no access to care or getting help. So it's very sad to see that even within certain communities that, there's no doctors, there's no, clinics, there's no people there to actually help Black people or people of color to stay alive. So we're seeing that too, that, without the access of care, we're dying at higher rates. We're, not aware of our diagnosis because you're not going to get tested. You don't have access to that. So it's just this revolving door of just no help and us continuing to just be the community who don't get help and no one thinks about. So that's why it's so important that we have these conversations where, we're making it known that we need to have access, we need to inform other people, we need to provide access and information so people can get the help that they need. Even if it does mean they have to drive an hour to it, we want to make sure that people have that care.
And that really speaks to these disparities, right? So we know that there are racial and social economic inequities in our community, and what you just highlighted truly speaks to those disparities. So thank you for that. So being that we're 40 years, right? Epidemic has been around for 40 years. Let's talk about a cure. Are we any closer to finding a cure?
Ciao. I really wish I can sit here and tell you we're close to a cure. I get asked this question by patients, I promise you, every single week, and I'm not being dramatic. Because, especially most of my patients have been diagnosed in the 80s and 90s. So they've been with HIV or AIDS for such a long time that they're ready to just stop taking these medications. They're just like, where's the cure at? Where's it at?
Right.
And I'm just like, we don't know. I have confidence in these brilliant people who are researchers in school, in science, that they're going to find something hopefully sooner than later. But I think what we can focus on is that, we have, the medicine that's helping us with suppression and prevention that we can hold on to for now until we get to that cure. And especially when it comes to prevention with PEP and PrEP, I'm hoping that's going to really make numbers go down. And something that I didn't actually talk about within PrEP and PEP is that even disproportionately, Black people don't even know about that information. If you look at the CDC, most people who are on PEP or PrEP are predominantly white men, because they are educated to know about this. They're aware. People go into the communities and just say, hey, there's PEP and PrEP. And no one's coming into our communities telling us about how we can prevent getting HIV. So even that, those advances are great, but a cure would be even better.
Oh, until there is a cure, we will continue to have these forums where we're speaking about these matters and educating our community. So let's talk about disclosure, right? Do you think that there's a fear of disclosing diagnoses to family and friends? And if so, what drives that?
Yeah, there's definitely a fear in disclosing, the fear of rejection, fear of, fear of judgment, fear, not even just fear, but, being ashamed of yourself for getting HIV and, wondering how did this happen? And when I talked before about, what the face of HIV looks like, right? You don't want your loved ones to think, oh, you were just out there just risking your life, having unprotected sex or doing drugs, doing this and that. And a lot of people get it from trusting a partner and just having unprotected sex. And so you just don't want that judgment, or you're scared. I have a lot of patients who are married or in committed relationships and they have not told their partners that they're HIV positive because they are afraid of what that means. Does that mean that you're not going to love me anymore? Does that mean we're breaking up? Does that mean my family's not going to want to be involved with me? And a lot of people may think that having sex while HIV positive means that you can report them. It's reportable. You can go to the police. But at least in New York and in California, that is not the case. It is something that is information that we can't tell anybody, and it's confidential. And, you know, we just encourage our patients to just make sure that they're having protected sex when they're having sex with their partners, taking their medications so they're undetectable, and so they won't infect their partner. And so it's very difficult to see a lot of people who are isolated in their diagnosis, which means nobody knows about it. The only people that know about their diagnosis is their team, their medical team. So a lot of people come to see me and it's just like a relief, like, oh, I can talk about HIV with you. I don't have to hide this big part of me, and I can talk to my social worker about it. But it's very difficult to see a lot of people who are very ashamed and concerned about that stigma that's surrounded by HIV, that they just suffer alone.
So is there a direct connection between HIV and mental health?
There is absolutely a direct connection with mental health and HIV. When you think about the stress associated living with a serious illness or condition, especially HIV, is going to definitely direct someone's mental health. And it's important for people to know, and for people who live with HIV to know, that they are at a higher chance of developing a mood, anxiety, or cognitive disorder because of this virus. I mean, think about it. This is someone who is having trouble getting mental health services, who may even have trouble getting access to care, who is experiencing a loss of social support if they did tell someone and someone, you know, rejects them. This is someone who may experience a loss of employment because they became so sick from not knowing they had HIV that they can no longer work. These are people who have to tell others about the HIV diagnosis. Can you imagine the anxiety? These are people who are managing HIV medicines and medical treatment. They're dealing with loss. I talked about how I have patients who were diagnosed in the 80s and 90s, and they're having survivor's remorse. They're the only one left that they know that has HIV. All their friends are gone. They're here by themselves. So think about all those things, and how can someone not end up having mental health illness with all that attached to it? You have this physical illness, and now that's now creating this mental health illness. So it's unfortunately very connected. But the good thing is like, you know, a lot of people are in care, you know, mental health care, and they're aware of it. But then there's that problem that I talked about access to care. You know, there's not many mental health providers who know how to talk to somebody about HIV. There's not a lot of mental health providers currently during a pandemic that have, you know, the capability of helping people who are suffering with HIV and their anxiety, depression, bipolar disorder, all those things. So that's another issue within itself, that, you know, access to mental health care. A lot of people aren't receiving it. So it's sad to see, but it's good to know that, you know, I have, you know, that I'm a part of a clinic that, you know, sees mental health as being something serious, that they have social workers for every single patient that comes. We have psychiatrists, but it's not like that everywhere. It's like that some places, but it needs to be more prevalent.
Well, I'd like to personally thank you for the work that you do. I mean, the passion and the advocacy and all that you're doing in this community to support. So let's talk about the community effort. We understand that prevention is a community effort. What can we do as a community to ensure we are informed and educating our community on HIV, prevention, testing, and/or treatment?
I mean, what you're doing now is one thing, is just like creating platforms to highlight that we need to be educated about this, and making sure our communities see something like this. Doing more testing efforts in our communities, like going to, you know, whatever grocery stores in those marginalized communities, or, you know, high impoverished communities or Black communities, where people aren't going to be like, hey, get tested for HIV. We need to set up those places and be like, we're swabbing, it's free, you can find out in 20 minutes, or encourage people, hey, go to your doctor and get tested. We just need to continue talking about it. And because since other people don't seem to care about what happens in our communities, we need to care. And that's what we're doing right now. We're having this conversation to make sure that our Black people, especially our Black women, know to get tested, know your status. And if someone watching this is HIV positive, please make sure that you are, getting the medical care you need to make sure that you live this long and healthy life that I'm telling you is attainable. All you do is just take a pill.
Yes.
And it sounds it sounds easy, but it is that easy to just, take a medication, and hopefully this, my information will be sent out. If you need help having access to care, I will help you find care, because that's what we need to do. We need to support
Yeah.
each other.
Absolutely. Thank you. So, in closing, can you offer 3 key takeaways or parting advice for our viewers?
So y'all heard me say this multiple times: get tested and know your status. That is the main thing that I want people to take away from this, is knowing your status. Information is power, and knowing information about what's going on in your body is so important, because no one's going to push you to do it. So I'm going to push you to do it. Everybody, make sure you get tested. Remain educated. I've said some things, you can look some things up and just like, oh, she talked about PrEP and PEP. What's that? That sounds like something that I should do. Or Makia was talking about, if I have HIV, I should get into care. Let me look that up, or reach out to Makia to get that assistance. Like, be educated, and educate others. Make sure, you're listening to this, or you may have seen just a portion of this. Make sure you talk to people about, HIV, AIDS, and getting tested and knowing more about what's going on with your body. My friends are sick of me anytime they talk about like all that dating cute stuff. I'm the realist, and I'm just like, oh, that's so great. Did you get tested? Do you know their HIV status? Because that's so important. It's not just about STDs, it's also about HIV. So make sure you see your doctors, get tested, and know your status. It's so important.
I have learned so much from you today. I know that our viewers will say the same thing, that they have learned so much from you today. And I thank you for just being an advocate and an educator in our community. And thank you for taking time today to support the World AIDS Day and what we're doing not only in our organization, but around the world, and really putting the access and the information out there. So thank you, Makia, so much for
Absolutely.
participating today.
Thank you. Thank you for the platform. Thank you for allowing me to share my passion with other people. And I'll say that what changed it for me was my senior year of college. So this was 2012. It was a medical sociology class, and our professor showed AIDS in Black America. And when I tell you I saw that and saw what HIV and AIDS was doing to our Black community, that changed the trajectory of the social work I wanted to do. And I wanted to make sure that I was in the medical field and being a voice to the voiceless. So I'm glad that you allowed me to share my voice and passion and information to just continue to help my community, because that's what I do it for. So thank you. Thank you so much.
Thank you. Thank you for being the voice.
Of course.